It's time once again for another episode of Georgia Business Radio. Broadcasting live from the Pro Business Channel studios in Atlanta.
Well, today we're live here on Georgia Business Radio, and you've got Michael Moore, Rich Casanova, and Artie Ruderman all in the studio to interview some fabulous guests for you. We're going to start out this morning with Dr. Allen. Wow, I'll tell you what, I got this title here that Dr. Allen's going to tell us about, which is wild, but value-driven population health. Just let that settle in for a moment. Figure out what it be. Dr. Allen leads the Harris Allen Group. He's founded in 1993 to improve the performance of health and healthcare. His clients have included employers and health plans and states, pharmas. Boy, I tell you what, he's just covered everybody. He's held posts at RAND, at Aetna, at Tufts Medical Center, Coopers and Lybrand. He's been in faculty at Yale, Thomas, Jefferson, and Brown. Whoa, what a set of credentials. He's he's presented and he's published very widely. He's first authored just so many papers, we would just be here all day talking about that. But value-driven population health has become a mainstay topic that we're all worried about, wondering about with all of our healthcare laws and changes. And as some of us are getting older every day, we're even more worried about that as to how our health is going to be impacted by not only regulations, but the type of health care available. So today in studio, we're going to have an exciting time talking about that subject. So, Dr. Allen, I'm just going to have to ask this question. Give me the heads up on value-driven population health.
Michael and Rich, thank you very much for this opportunity this morning. Delighted to be here. Value-driven population health, its mission is maximizing the value of every dollar spent on population health or health in populations. And the genesis comes from the observation that we in this country spend so much more per person on health care than even the next developed country, 1.5 times as much as second-ranked France. While at the same time, our aggregate health outcomes are mediocre at best. We're ranked 27th among OECD countries in life expectancy at birth. All right, so
I'm feeling poorly right now.
Yeah, we simply do not get nearly the bang for the buck. And value-driven population health is about the business of bringing two relatively well-formed areas of science together, value and population health, into one new system. It offers objectives, measures, and tools that are focused on measuring and managing outcomes and costs in combination with one another for each of the major stakeholder groups that are determining health and healthcare outcomes in our country. You've got providers, obviously. You've got patient consumers. You've got purchasers like employers. You've got suppliers like pharma. And you've got health plans, what we call payers. Mm-hmm. Each of these different groups, by virtue of the decisions that they are making, are contributing to the overall dilemma that we face. Outcomes, outcomes that are mediocre at best at the aggregate level, coupled with high costs.
Well, now the high cost is what scares us all. And we do know that employers have a responsibility, and we're an entrepreneurial-based marketplace as well as a big company-based marketplace. And as you said, the insurers have to be able to manage the expenses as well as the hospitals try to. So how is that beginning to play into the big data game and looking at, we have so much information available now, why can't we do a better job, simply?
That is the million-dollar question.
A million or a whole lot more. How many trillions did we spend in healthcare in America today?
We spend an awful lot. Here, what we boil it down to is it's a matter of community will.
Okay.
Right. And what we want to do, I've recently relocated to Atlanta, as I was mentioning to you earlier.
Well, welcome to our great city. We're the center of the earth, right?
I grew up here, but then I went away for a bit and I have come back. Right. I would love to see a community initiative get started here in Atlanta, which is about the business of bringing different stakeholder groups together, everybody agreeing on benchmarks that reflect bottom line performance, and then fostering dialogue, conversation, and competition ultimately amongst the various stakeholder groups relative to those outcomes and cost benchmarks. And through a continual process, which we envision, Atlanta has an opportunity here to do something that literally is not being done elsewhere in the country like it needs to be done. You have obviously breakthroughs that are being made with respect to improving value, but none where you're bringing all the different stakeholder groups together and working on a common undertaking. We actually have, I think, a really good analogy, if I may say so myself.
Well, why is Atlanta? Go ahead.
We together are on a ship that I'll call the sinking Titanic.
Oh no! There we go.
Is there another version of the Titanic? Yeah.
we simply can't continue on in the way we're going. We just can't. And we have to change that. So,
quick question. So we're on the Pro Business channel. So talk to us about the corporate role and in your arena, and how can companies, organizations be proactive, and what's some upside to taking a proactive role?
In our experience, the stakeholder group that has made the most progress with respect to improving how it performs its role as purchaser are purchasers.
Right.
So employers,
right,
via well-done workplace wellness programs, have made demonstrable gains with respect to improving the health and productivity of their workforce while reducing what they're spending in healthcare. And one of the things that Sheldon will be talking about is this conference that we have upcoming in September, where we're bringing self-insured employers together to talk about some of the breakthroughs that are being done, not only with respect to benefit design, but with respect to prevention, improving cultures of wellness in the workplace. And what we're also going to be talking about is what the implications are here for other stakeholder groups. Employers have set excellent models, leading employers have set excellent models for other stakeholder groups to improve how they're performing their roles.
Dr. Allen, one stakeholder you did not mention in that list was the government, and I was curious, the state and federal, do you address them?
Yes. The state government is oftentimes in the purchaser role. All right. So employers and Medicare and Medicaid all are considered purchasers. And in that sense, government can itself be doing a better job in the purchaser role by adopting and implementing some of the strategies that we could bring to the table. Absolutely.
Now, these are all broken down based on the fact that, as you said, you've picked Atlanta. I know we had a conference here back in May, which began to unleash some of these ideas over to CDC or Emory or somewhere. I remember hearing about that. But in actuality, it goes back to everybody kind of reporting what their outcomes are.
Yes.
And then beginning to manage those back against that thing called, quote, big data,
yes,
to allow people to build some models which begin to have a better result. And how do people begin to get the advantage of all this great knowledge? I mean, how do we get it back out to the employers, to the government, to the hospitals, so forth? Talk about those things, if you will.
When we analyze big data, the challenge, of course, is converting that data into useful information. And there are a variety of different reporting strategies that have been developed that can be contoured to the specific different stakeholder groups. And what we envision here is an initiative that, in fact, would be continuously and routinely reporting back cost and outcome information that are relevant to how each of the different stakeholder groups are performing their roles.
Well, we'll be interested to hear how we might develop that. I know you mentioned that one of our other guests has a conference upcoming to kind of begin to do that. But Dr. Allen, one thing is I know that many of our listeners want to get in touch with you directly. And you said you've moved back to Atlanta. So how do we get in touch with you again?
The
best way.
The Value-Driven Population Health Initiative has a website. Real simple. VDPH.us.
That's
VDPH.us, and there you have all sorts of contact information. You can reach me directly.
Very good. Well, we look forward to following up with you and maybe having you back in the studio after we get some results of the process. So here on the Pro Business Channel, we're going to move on to our next guest now. And Mr. Casanova, would you bring the next guest to the table?
Absolutely. I want to welcome everyone to Georgia Business Radio, being brought to you in part by the Pro Business Channel Networks. Your host, Rich Casanova, alongside Michael Moore and Artie Ruderman. And we're going to begin a conversation right now with our first guest, Sheldon Tyndall, an experienced executive in the healthcare IT space, filling roles of CIO, enterprise project manager, consultant, and business owner in the past 41 years. Wow. You don't even look all 41 yet.
Thank you.
Yeah. Currently, Sheldon's involved in an event management company, S4 Events, dedicated to providing quality events in the healthcare space. Currently, S4 is hosting an employer healthcare cost reduction and quality improvement conference coming up here in September. So, Sheldon, talk to us about this conference. What do you hope to accomplish? What are some takeaways that an attendee might experience?
First, appreciate all of y'all letting us be here today. And the conference that we're putting together in September 13th at the Galleria is really an all-day conference that's designed around companies who have a high expense in the healthcare cost line item to cover either some sort of health-related cost for their employees. Typically, that line item is number 2 or number 3 behind raw materials and direct labor for almost any size company. In our world that we live in today, companies who have over 50 employees are required to have healthcare coverage. Those that are under 50 and under don't necessarily have to do that. So our target market is really the decision makers for the healthcare cost responsibility on the expense side for companies. I mean, we certainly would welcome companies less than that 50 who do provide some sort of healthcare coverage, but it's really targeted to any company who has a desire to reduce their healthcare cost spend. And then we've got a good lineup of speakers, including Dr. Allen and others, locally and regionally as well as nationally, and hope to really bring some awareness and education around how to go about reducing that dollar spend, 2, 3, 4, 5, 10, 15, 20%, with the objective of reducing cost and improving quality outcomes.
So correct me if I'm wrong, but this is the first of its kind, right? I mean, you've been doing events under your event management company for a number of years, but this is a new venture for this specific event? Yeah,
as best we know, there's not a dedicated conference series around the country that does this. You can go to conferences, particularly healthcare conferences, that talk about reducing cost from the provider side, but they're really not dedicated to the employer marketplace. And our objective here is to really reach out to all companies across all industries, healthcare included, who has that expense line item that says, hey, look, we want to reduce our cost and we want to get the outcome of having better, healthier population health, employee population.
Sheldon?
Yes, sir.
Who will be attending the conference? Will it just be purchasers? Will it also be providers?
So we're reaching out for attendees to be basically a decision maker that could be a benefits or an HR person in a company. It could be a CFO, could be a CEO, or could be a multitude of those. We're really trying to get to the decision maker of who can make some choices about how they go about covering their employees. It could be a provider. It could be a healthcare provider. It could be a physician's office. It could be, companies across all industries, because we all have that same, companies have that same line item, if you will, that healthcare cost line item.
What's the format or agenda for the conference?
So today we have at least an hour slots of speakers lined up from about 8:30, 9 o'clock to 3:30, 4 o'clock or later. The idea is to have a speaker talk about their subject of expertise, and then we will have, at the end of the day, we'll bring up all of those speakers back up on the stage to do a Q&A. We may very well have at least one, maybe more panel discussion. So we take these experts, we put them up on the stage, and we do a dialogue of Q&A through that panel discussion.
Well, one of the problems right now is the confusion about what the results are of healthcare. As a company decides what they can afford based on the model you said about the financial side, and then you have the insurers deciding what they can afford to provide. You have the hospitals providing what they want to provide, and then you have the government asking those questions about how this all is supposed to work, and we don't know how to tell you to make it work. right now we're in a whole lot of confusion. So is this program really going to help these providers of employee benefits per se do a better job?
I'm counting on that. Actually, our U.S. healthcare system is very complicated, and we have not got the time today to cover that. But I have my own thoughts about it that I'll share at a later point in time. But the point is that it's been proven over the past recent years that employers who take ownership of that employee health population of their employee group have made some significant improvements in health status, outcomes, and cost reduction. It simply means they need to be doing something different. And we're not necessarily trying to turn their world upside down. We're just saying, look at some of these options that from the people who are going to be our presenters, expert presenters who have case studies, who have who are employers, who have made a difference, and various different speakers who are providing some level of different way of thinking about how to take care of your employee population.
Well, I know one of the reasons you mentioned to me you decided to do this program was because people did not know what some of the success factors were. They did not know some of the true stories of how employers had provided a higher level of coverage through less expense, as you say, saving some dollars, but also improving the lives of their employees, which is going to improve the result of their company.
Correct.
So talk a little bit about the founding idea of putting this conference together and seeking out experts like Dr. Allen to be on your staff.
Yeah, appreciate you asking that. So this conversation actually started many months ago, and it really was around the idea of where we talked with a broker who specialized around healthcare, and then we began creating a bigger circle, if you will, of people who were involved in that. And in Georgia, there's a pretty big effort, or of at least initiative, of trying to reaching out to companies who are already in this mode of how do I do something different to, instead of looking at 2, 3, 4, 5% increases just because that's the way the world has been for the past 30, 40 years, how do I look at increasing my health employee status and maybe doing it in a very different way that gives us less cost? And so that's really the idea of how this whole thing got started, and it's still on an evolutionary snowballing effect.
Well, I know you mentioned you'd had a lot of interest from other folks, as well as you're beginning to finish up building your speaking staff and your presentation people. But, what are your outcomes you're looking for? I mean, really?
So our outcomes that we're looking for are really a much bigger growth of companies who are willing to step up to the line and say, let's do something different for our employees that make our employees happier, make us happier, have higher productivity, and if at least they begin that dialogue. So if the idea is that we have a number of attendees who make connections with the presenters, some of the companies that will be attending who have already crossed that line and will be either sharing their stories and or learning what other companies are doing. So it's really a networking, sharing of experience, listening to experts in the field, listening to case studies like Dr. Harris is going to bring, and a whole wide variety of nuggets of information. And if they can walk away with one or two nugget, if you will, that would save $1,000, $2,000, $5,000, thousands of dollars, which is certainly predictable, then everybody wins.
Well, and also improving the quality of care, which is really all about. It's about personal results, which is what we're really interested in. So, Rich?
So give us a little bit of rundown on the event itself. Like, how would people get tickets, participate? What's the hours of the event and the location and so forth? Yeah.
So the location is at Galleria here in Atlanta, Cobb Galleria. The conference will start actually about 8:00 with some welcome and
coffee. You got to have coffee.
Yeah, we got to have coffee. Yeah,
you're in big trouble if I show up and there's no coffee. Yeah,
you can rest assured if I'm there, we're going to have coffee.
Nice.
Yeah. So we'll have that. You can register at the URL for our conference website is GreatReveal, GreatReveal.com. That takes you to our website. There's some links on the homepage that'll take you to the registration for attendees as well as exhibitors who might want to exhibit. And then there's some other tabs for some other information that kind of explain our speakers' schedule layout, et cetera.
Now, I've been to the website, and as a WordPress genius or guru, I'm not sure which one I am, but but it's a very impressive website, by the way. Yeah,
thank you very much.
Just as a footnote. All right, so Sheldon, pleasure having you here on the show, on the Georgia's Business Radio Show. We look forward to the event coming up in the fall here.
Thank you.
Welcome to the Georgia Business Radio Show here on Pro Business Channel Network. Sitting alongside me from Pro Business Channel is Richard Casanova and Michael Moore. Our guest today is Harry Mack, founder of Dreams Inc., and that's Dreams with a Z.
That's right.
Like you're falling asleep. A Z's, I just got it, yeah.
And Dreams is a custom website design, strategic marketing, and branding company. And boy, I wish I had met you 3 months ago. I have been laboring over my website for 3 months now. So I'm very interested in what you have to say. Welcome, Harry.
Thank you so much for having me, all of you. It's a pleasure.
Thank you. I'm always interested in the personal bio of our guest. Can you tell us something about your background and how you became engaged in website design and marketing and the industry itself and Dreams?
Absolutely, sir.
Go Dreams.
All right. So, as you said, my name is Harry Mack, and I'm the president and founder of Go Dreams Inc. We founded this company about a decade ago, which we called Dreams Unlimited Studio. And in 2014, we incorporated to a newer brand, which is Go Dreams. I'm MBA in marketing, and marketing has been my passion all around. I've did some corporate jobs as my experience before I decided to become an entrepreneur. And I always wanted to help these small business owners, give them tools and resources, which I have seen as a corporate employee that the bigger corporates have at their disposal. And I thought, why not, mix and combine those tools and strategies and give it to the small business owners and have them opportunity to grow their businesses. So that's what we do at Go Dreams. We have a very powerful award-winning dashboard which we provide to these small business owners, which gives them all these tools.
Your company provides custom and, according to your website, unique website designs.
Right. That's right.
Tell us what differentiates Go Dreams from the competitors.
The number one is the number of awards. If you go to my website, I'm not bragging about it, but literally we got tons of awards for best web design and marketing company year after year. Recent one being the best of Gwinnett web design and media company as well. We have developed some real unique, and here's the difference. When we work on any project, be it design or be it marketing campaigns, we focus on the customer's vision. That means what exactly you want to achieve, by creating a site or by setting up a campaign. And that's where the difference is.
An internet is really, for marketing purposes, just a giant billboard. So how can you quantify the effects?
Absolutely. So that has been changing almost on day-to-day or month-to-month basis. There is so many types of innovations and technological update happening in the industry as our online marketing is concerned. And that's where our dashboard comes in play. And we actually do create a lot of automations, which again gets the prospect user or a prospect customer into some kind of a marketing funnel for our client, and that creates a never-ending communication between the business owner and the prospective customers, and that just keeps changing again. And depending on what kind of upgrade the overall industry gets, we are always trying to adopt those changes.
Well, Harry, let's drill down a little bit into that analytics and that information opportunity. It sounds like to me you take a lot of pride in making sure your agency trains the people who actually need to use the website and take some of the day-to-day burden off of that communication process with your great agency. So talk to me about some of the success stories or testimonials of your customers and what kind of results you've seen out in the marketplace.
Excellent. That's my favorite topic indeed.
Go ahead. Talk about yourself. Talk about yourself.
I hope we got enough time for that today. All right. So success stories actually includes multiple segments, right from a national bank to a small business owner to a restaurant entrepreneur. And one of my favorite stories is how we have made this huge change in the overall hospitality industries. So what you've done is we have created a system on our dashboard which actually starts right at the point of sale system when a customer walks in to buy something, and that first transaction, what happens from there all the way to their social media or to their mobile numbers or cell phone numbers, everything is taken into consideration when you're sending those communication, of course, with the consent of the end user. So you don't want to spam people,
When's their birthday and how much did they spend last time, right?
Yeah. So everything, like a lot of our customers who have our system, when their customer call in, the guy would actually answer the phone with the name and would be having the ability to actually tell them, oh, so you want your favorite, pepperoni pizza with pineapple on it, or whatever is his favorite. So that level of interaction and data and analytics is available at the disposal of that cashier standing behind the restaurant counter, and he doesn't need to remember a thing. All he has to do is just answer the phone, and the system shows him all the data.
Now, so you've grown into this business, and it's been an evolution. You've been at it for a number of years. What have been some of the challenges you've overcome, or some of the blinding flashes of the obvious you've integrated your business to make it even better and better and get all tons of awards, as you mentioned earlier?
Excellent. So the one of the challenges, and it's also kind of a great thing to have, is the constant update in technology. It's been changing at a rapid pace. If you're an agency who cannot adopt those changes on a regular basis, if you cannot deliver what the customer requires, that's something which has been very challenging for us. But we have a very healthy training process internally for our team members, as well as we keep that training to our customers as well, to the business owner, that how and what tools will be used whenever there is some kind of a change. Example, the huge change in the POS industry when EMV came in. So we had to adopt to all those different devices which are already there in the market, which people are using, and come up with a quick solution so that EMV is not a problem for them. And we did it in the quickest turnaround time. I think the very first few companies who actually could complete the integration of EMV across was GoDreams. In Atlanta market.
Well, congratulations.
So speaking of companies, well, first of all, I like the premise behind dreams is because it signifies vision.
Absolutely.
Right. But beyond that, you mentioned companies. So drop some names. I went to your website. There's some pretty impressive brands on your website. Drop some of those names if you would. Yeah. So the most popular names would be including MF Sushi Atlanta. If you guys have heard of the Grindhouse Burger and K Wings. We have huge clientele in the Indian hospitality. Anyone feel like Indian food here? Yeah. Did you bring some with you? Yeah.
Yeah. So
now we really like it even more. Yeah.
Absolutely. So again, as far as the Indian hospitality goes, I take a lot of pride because you would see probably 90% of the Indian restaurants or Indian hospitality businesses are our clientele right now, as of now, and that's a huge pride for me and my team as well. Another big names are Embassy National Bank or Underwood University or the list can go on.
And so, what are some challenges or do's and don'ts of things you see with some of your clients when they're coming on board, that the mistakes maybe some they're making in their website and their marketing?
Yeah, so I think the most biggest challenge that we have seen, and the mistakes that our clients have seen obviously making, is a lot of time they come up with preconceived notions that this thing can only do certain amount of stuff. So they have no idea, no education about, like, social media, for example, is a very powerful tool, but a lot of time the client don't understand the power of social media. Right. New things like recently, like Facebook actually opened up an API to create more automations on Messenger.
Right.
Now, not all the agencies know that, and not the customer don't know that about it. And when we pitch them and we tell them this is how we show them one of the automations we've done for a client, right, and they're like, oh wow, is that even possible? Even can we send information to our user directly on his Facebook inbox, not on his timeline, right, not as a blog post, but something going in his Facebook inbox? And our answer is yes. And they're like, oh wow, we've never heard about that.
There's a Facebook inbox?
Yeah. It's called Messenger.
Messenger. I've turned that on and off, whatever. I can't decide if I'm adopting that or not. And we just discovered you can now have a video instead of your banner on Facebook, whatever, right?
Yeah.
Which is really cool.
That's pretty cool. That's the latest update. They've come on the business timelines.
Man, we may need to have you back talking about GoDreams print and your other ventures and updates on your business and so forth. But for right now, Harry, what's the best way for people to reach out and get in touch with you?
Excellent. So the best way would be to actually download our app. Go to your iOS device or your Android device, type GoDreams, GO space DREAMZ, and then you see our app right there. Download it and click on sign up. That's one way to get an access to our dashboard, something which we actually offering to all the listeners of Pro Business channel. today that if you want to go ahead and download the app, and if you click on sign up, you're going to be having a free access to your dashboard only for today, whoever is listening to the
sweet.
show.
Oh, wow.
All right.
I love dashboards. Does it come with a Corvette or Ferrari or a Maserati?
Is it a self-driving dashboard? Yeah. It's nice. And so you have it for apples and also for oranges, because I'm an orange, not an apple, right?
That's
So you have it for
Android.
both. Okay, yeah. All right. So, Harry, pleasure having you on the show, on the Georgia Business Radio Show.
Thank
Look
you.
forward to seeing you soon.
If I could offer one additional thing.
Sure.
What is not commonly known here in the state is, despite all the wonderful innovation and breakthrough that we see, particularly in the Atlanta area, the state of Georgia is actually ranked 48th out of the 50 states in terms of health outcomes. And so there is a lot of room for improvement here. And employers have the opportunity to lead the way here. One other point that's worth mentioning. We can't make workplace wellness the specific and only cause, but we know that that employers that do workplace wellness well actually can outperform the stock market. There have been 3 studies recently done that have shown that portfolios of workplace wellness winners have outperformed the S&P 500 by anywhere from 8 to 16%.
No, I can imagine that, yeah.
It's really quite amazing.
Yeah.
Now, we can't say workplace wellness is the only thing.
Right, yeah.
But it's a big part of it.
All right. So, gentlemen, that wraps up another episode of Georgia Business Radio. We'll see you all next time. We've been talking about doing a spotlight episodes, a series on just corporate wellness. So we may need to re-engage on that, yeah. And we'll need some help in social media and marketing that. Yeah. So
Dashboards.
yeah.
I'm all excited about dashboards.
Go Dreams dashboard.
Yeah, we'll see you guys next time.
Thank you again for joining Rich Casanova and our guests on the Pro Business Channel. Use the social media links here to share today's show, and stay tuned for the next episode of Georgia Business Radio.